let's kick things off today with one of our newest providers, Dr. Dawn Young. And she's with Oceanside Family Medicine here in Leland. How are you today, Dawn?
Doing well, thank you.
Thank you so much for coming today. I'm so excited to meet you and to spend time with you, and I know our viewers are going to love this. So you're new to the area.
I am.
So let's kind of start with the basics. Tell me a little bit about yourself.
Well, I've been in family medicine for 30 years now.
Really?
I have spent all of my career up in northern Indiana, in South Bend, where I practiced family medicine there. I went to medical school in Kirksville, Missouri, and then spent the rest of the 2 years of medical school after the actual school part of it, traveling around mostly Midwest, a little Southeast, doing student rotations.
Right.
And then I did my residency in South Bend, Indiana as well.
Are you excited to be here on the coast?
Oh, absolutely. Yeah, I moved here mainly because of weather.
Really?
South Bend, Indiana can be about 6 months of cold and snowy weather. So it was refreshing to come into an area where I knew the worst I was going to get was maybe 40 degrees and no snow.
Yeah.
So,
Had you been to the area before?
I had. My sister actually moved down here a year ago, and so we visited actually on the 4th of July weekend last year, and right when the tropical storm Colin was hitting, but that did not detour me to come back here. So yeah, no, we knew once we got here this would be the place to move.
Well, that's awesome. We're glad you're here.
Thank you.
And Leland is such a growing community, and I know the healthcare, we really need more healthcare in that area.
Absolutely.
So I'm sure you're busy already.
I am.
So you say you've been a primary care physician for 30 years?
30 years.
So what made you decide to concentrate on family medicine?
Well, I think when you start doing student rotations, you try to find things. I initially thought I would be a pediatrician, but I did 1 month of pediatrics and decided I did not want to do that every single day. So I like the span of, I always say 0 to infinity. So, and I had a concentrated older adult population in South Bend, but here I'll be getting back into pediatrics a little bit more. So.
Oh, that's nice. Yeah, that practice does see quite a few pediatric
children.
patients. Yeah.
So
but that area has a lot of young families with lots of children.
Yeah, that's what I've noticed already on my schedules.
Yeah, that's pretty cool. So let's talk more about annual wellness visits, and some people call them yearly checkup. I call it a yearly checkup. So, and a lot of people I hear they just don't prioritize that.
No.
What are your feelings about that? Is that a bad thing?
Not prioritizing it, yeah, I think it is a bad thing. I think that doing a well adult physical exam once a year is a good thing. It gives people a chance to find out something that could be lurking there that they wouldn't know about unless they came in and perhaps was an incidental finding on a test. And so getting screening mammograms and colonoscopies and blood work, all of that's really important just to kind of get a level basis of where you're at.
I always refer to my primary care physician as like the leader. He looks at, or she, they look at everything, all the places you've been and all the doctors and all the medications, and he's kind of my maestro of the orchestra.
And I really do believe that. I think that a good medical team starts with somebody in the center, and for the most part the family practice doctor is that person coordinating every bit of the care.
Yeah. Well, tell me what your annual wellness looks like. What all would you do during your a patient's annual wellness visit?
Well, it depends on the sex of the person because there are different testing. But for the most part, annual wellness visit would include going through a history and seeing if there's been any changes with anything, including medications, procedures, etc. And then also focusing in on any testing that they have not had, vaccines that could be updated, blood work to be done, do they need any screening, x-rays or that sort of thing, and then getting it all coordinated, and then making sure there's nothing acute along the way, but generally the chronic stuff.
Yeah. I'm sure family history comes into play there.
Absolutely.
So what about folks who don't know a lot about their family history? Maybe they were adopted or something like that. And then I hear where folks say, well, I'm scheduled with a new primary care, but they want all my old records. Right. Is that absolutely necessary?
It's not absolutely necessary. I think it's important if we can get that, just because you have base or what do I want to say, like the old results to compare to. Frequently we'll say, you know, there's a new change on your mammogram. I wonder if the old mammogram had this on there and it maybe wasn't seen, or it's a new finding. So getting new findings, it's always nice to have something to look back on. So it's good. It's not absolutely necessary, but it could be a very needed thing. Yeah.
So now we're into summer, and a lot of people are exercising and dieting and working on, you know, getting in better shape. So does that help when they come in for a physical exam? Do you talk about that, or do you like lay out a plan for?
Well, I think it's always necessary to talk about a good diet and exercise, and some people need it more than others, and some people just aren't exercising. And so I always make it a point to encourage a proper diet or a healthy diet and exercise. It doesn't have to be every single day, but I think that it's important as people stay active. I'll have to say I used to see a lot of 80 and 90-year-olds, and all of those patients, they were active every single day. And I think that's what, you know, joints like to move. So definitely.
Yeah, they do. Even when I get up in the morning, my knee kills me. But as soon as I start walking around, and you know, it feels so much better.
I always say we're like the Tin Man. Once we get a little bit of lubrication, we feel pretty good after that.
So, are you taking new patients?
Yes, absolutely.
Yeah. So how do we go about making an appointment with you?
Well, you can call the office at Oceanside, Leland, and I am not familiar enough to know if there's a call center, but I think either direction would get you to a new patient appointment with me.
Well, that's great information, and it's been so nice to get to know you.
Thank you.
I think you're so easy to talk to. I think your patients are going to love you.
I hope so.
Oh, they will. I know they will. So thank you so much for being here today. I hope you'll come back, and we'll find a specific topic to talk about.
All right. Thank you so much.
You're welcome.